So vaginismus, we think is not common, but that is more common than what we actually think it is. So it is pain when you're having penetration. It does not necessarily have to be sex. It can be penetrating your own finger. It can be penetrating a speculum for examination by a doctor. What actually happens is all your vaginal muscles kind of constrict and tighten in a way, not letting something to come inside the vagina. It is a protective mechanism that your vagina or your body takes over. Why this happens is a very interesting question, because there could be two things as to why vaginismus can happen. One is there could have been something that has psychologically happened in your past that could have kicked that mechanism in your vagina, which is saying, okay, no more. I don't want that to happen anymore. And I want to protect it from coming inside my vagina. So that could be something as simple as childhood trauma, sexual abuse, assaults or rapes, and things like that. Or there could be other things that could have happened, like injuries, like, you could have had like an accident when you were young, or something could have hurt you, or an examination need to be done by a doctor when you were young, probably hurted you and probably was a very traumatic experience. So those kind of things can cause that kind of vaginal tightening and your vaginal muscles to get all spasmed and closed up. So it's your body's mechanism of saying, no more, I don't want to send anything anymore. So that makes sex painful as well. So anything painful to get penetrated into the vagina is called vaginismus, and there are several reasons to why vaginismus can happen. With vaginismus, it is very important to understand that there could be a psychological part of vaginismus that is also happening, and there could be a physiological part of vaginismus that is also happening. So when we say painful during vaginal penetration, it could be psychological, or it could be there is a problem there, why that is happening, and vaginal muscle spasms and things like that. So it is very important actually to address this with a doctor, a psychologist, and a physiotherapist, because there are a few elements involved in muscle spasms and vaginal spasms. We always recommend working as a team. So first, it's very important to see a doctor for, an examination to see if there is anything else that is really happening, or is it just purely contraction on tightening of the vaginal muscles. So that's very important. The second thing is to get a good history to see why this is happening and what could have happened to cause that kind of vaginismus, in a woman. Like, for example, it could even be something like, you watched a traumatic movie or a film that showed, that sex could be painful, or you could have seen, or some friend could have, had a terrible experience, which they probably came and shared too early with you. And now you're worried or you're freaking out that it is going to hurt you. So there could be so many elements as to why vaginismus can happen. So a very good history, a detailed history and knowledge of why this is happening is very important. And like I said, if there is no, anything that is physical that is happening, or any kind of, examination that shows any kind of abnormality, a psychologist plays a very important role in helping with somebody's vaginismus, because a lot of the time it is the psychological trauma that leads to the muscles to actually spasm and constrict and not let anything else go in, and making penetration painful. Secondly, the muscles have kind of, the brain tells the muscles to spasm, and the muscles have spasmed, and it kind of has gotten used to spasming. So we have to have exercises and relaxation techniques that kind of relaxes the muscle. So a physiotherapist comes in at that point, and they help you do pelvic floor exercises. You have like Kegels and balls that you can use slowly to relax your pelvic muscles, masturbation with small size toys, and slowly, gradually increasing so that you feel like things are under your control. Those kind of things are very, very important. So with the types of vaginismus that are present, it is very important that we take an approach that is, multi-team approach, which is usually very, very beneficial in order to treat vaginismus. The basic problem that arises among, sex being painful or something penetrative being painful is the fact that people are not educated about it. People don't know how common it is. A lot of the time, people are scared or they are ashamed of the fact that sex is painful for them. A lot of women don't come to us until they reach a point of where the marriage is at stake. They usually, it's not even about the pain, it's about, oh my God, what will happen to my marriage if, I'm not able to have sex. So only after they reach that point, they actually tend to come to us. So my understanding is lack of education and, lack of sexual awareness and the stigma that is there around talking about anything that is related to a vagina is just, I think, immense. So the minute it comes to your vaginal area, or anything to do with your pelvic region, people are very shy and almost very ashamed and feel mortified to actually come out and talk about it. And I think that is the biggest problem with vaginismus and its psychosocial effect it has on women. I think it's very important for women to know that sex is not painful. Sex is not meant to be painful. It is not something that you have to tolerate. Sex is actually something that is immensely pleasurable, and it is something that actually bonds to individual, makes two individuals vulnerable and in love and romantic. It has an absolutely, it's almost like a drug. It has like an effect of a drug, and that is how sex should feel. If sex is not feeling that way, something is wrong. Whether it is not feeling that way emotionally, or whether it's not feeling that way physically, or whether it is not feeling that way in your genital area, something is wrong. You've got to stop. You've got to come and talk to a doctor, any doctor, to say that I'm not feeling right, because the feeling you're meant to have with sex is actually very, very pleasurable and in ease. And if that's not happening, if there is pain, you should address it, because a lot of people have it. You're not just alone. I just want to tell women, who are having painful sex or finding it difficult to have sex, that you are not alone and you don't have to feel ashamed about it or anything like that. There's so many women who are probably in the same boat as you are. So I think we just have to be out there as a support system to each other, and you have to reach out to one of us doctors who will probably guide you through a right path, talk to you about what's going on, why is this happening, and look into easing you up and making you feel comfortable. And that's our job. And I think that is how we are looking towards vaginismus. So painful, pain during penetration in your vagina is not uncommon. You'll be surprised. So many women have it. So just reach out to us. When you penetrate something into your vagina and it is extremely painful and you're not almost able to do it, then you can probably think that maybe you have vaginismus, right? So just I'm just saying it in a very broad way for people to understand that that's not normal, right? So let's say as a very youngster, you're using your finger for masturbation, and that's really hurtful. Sometimes you can use a good lubricant to see if, if that is helping that pain. If things are dry, lubricants just absolutely make it smoother. So I'm a big, recommender for lubricants. You can use that, and you can, if your toys, like if you're masturbating or if you have sex toys and if that's hurting, and then comes your sexual partner and, things are hurting during sex or whatever it is, I always tell people, don't self-diagnose. I mean, it's nice to be aware. It's nice to be aware that this is not normal, because people always say that these things should be pleasurable, right? So when it's painful, I think it is important for you to recognize that it is not normal. But I would never, encourage people to actually diagnose or self-diagnose, themselves. So my first thing and advice to women is definitely reach out to a doctor. And what I also want to tell them is, if you have a bad experience with a doctor and you're not able to explain this, or they brush you off, please pick another one. There are millions of us in a population of 1 point odd billion. So pick another one. So don't get very disappointed when people are not having the right attitude or are brushing you off, because it's very important to address this. And I feel like a doctor has to, like I said, get a good history of what has happened and why and from which point in your life, because a good history taking is very, very important, and it's a very, very essential part of sexual health. And the second thing is a good and a thorough examination. You want somebody to actually examine to see if you've got any lumps or any bumps, any growth, any cuts, or anything that is happening that looks abnormal down there, which is the cause for the pain rather than just vaginismus. So if you're having something that is pathologically sitting there that's causing you pain, that's different. Then you treat that, then that pain goes away, and that's different. When all of it looks like it's perfectly fine, but still it's just not going in and you feel like it's really painful, then we say it's probably vaginismus, that your muscles are just constricting and not letting anything go in, because everything else seems to look okay, seems to look fine. There's no lumps, bumps, cuts, ulcers, STIs, whatever that the doctor has to look for. So I always recommend that people should go and see a doctor, talk to a doctor, open up, get an examination, talk about things, get tests, if it's needed, STI screens and stuff like that. And then after everything is ruled out, the doctor can tell you it looks like you've got vaginismus. And then once that's been diagnosed by a clinician, I think then it's a good path to see who you have to see, depending on what's going on. If it's, like I said, it's a team effort. You see a doctor, and then you need to see a psychologist. Then you also need to see a physiotherapist to work on your pelvic muscles to relax, because it's been constricting for a very long time, and things like that. So usually that's how you take it forward. Unfortunately, sexual and reproductive health is not a specialty by itself in India. So a lot of people in different professionals actually look into people's, vagina and vaginal examination. So, for example, I think your obstetrician and gynecologists are definitely the people that you can definitely go for that kind of an examination and discussion. The second, you can also see dermatologists, because we see a lot of, skin conditions and skin related things that cause vaginal, you have the vulva, and the vulval, skin sometimes is connected to the vagina, and dermatologists see a lot of this as well. So you can actually see a dermatologist. And sometimes, like if it's STIs related, again, dermatologists also see a lot of STIs. Infectious diseases specialists, see a lot of STIs. So that could be some person that you can start with. Or we do have general physicians, people who are, we call them GPs or general practitioners, your family doctors, as we call. We can start off with them, because if they are really tuned into this, we can start this conversation saying that, I think something is wrong because it's hurting. So these kind of conversation can be done with any of these doctors. But to be honest, what is interesting is you don't have to worry so much about which doctor you have to go and talk about this to. You know why? Because I think it is the doctor's job to actually put you online with the right doctor. And I think we are kind of taught to refer to the right specialty. And I think that is our job. It shouldn't be your job. So let's just say that this is happening and you're going and seeing your family doctor and having this conversation, and he or she doesn't actually know much about this. They should be able to say, what, I think you should go and see this gynecologist. So they should be able to refer you in the right pathway to the right person. And I think that is a doctor. It can be any doctor's job to do it. Or in fact, it can even be a psychologist's job. Let's just say you Googled and you thought vaginismus is a psychological thing. And you said, okay, let me take an appointment with a psychologist to go and talk about vaginismus, right? It is a psychologist's job to actually ask you, did you see a doctor? And, to actually, for you to diagnose that it is vaginismus, and it's not like some kind of tumor or something that, you're having there, or some kind of growth that is blocking and not letting things in, or that's painful. So it's very important the doctor has a look. So I think it's a psychologist's job to actually say, okay, I think that, you need to go and get this examined. I think you need to go and see a gynecologist, and then refer you to see a gynecologist. So I think any specialist, any profession, you go and talk about this, they should then be in a position to actually guide you to the right person. So let's say your aunt is a cardiologist. We do have all these doctor aunts and uncles in our family, and we just think doctors means we can talk about anything. You pick a cardiologist and you talk about knee pain, and that's very common in the family. They say, you know what, doctor, I wanted to tell you I have knee pain. Sometimes you want to say, well, I think I'm taking care of heart at the moment. So I think any doctor. So if you go and see your cardiologist aunt and say, like, look, I think I have pain during sex, it's her job to actually say, is that right? I think you should see my gynecologist friend. So, so I think it is a doctor's job. It doesn't matter what specialty you're in, but if it is not your specialty, it is your job to guide someone to the right specialty. And I think we kind of, as medical practitioners or clinicians, owe that. It depends on what is causing the vaginismus, right? So if it's like something that's very light and something that's been, there because you haven't been exposed to anything, and then, very rarely, sometimes a relationship or you're in love with someone and things go very easily, and then one leads to another and things could ease. Because when we're talking about things that are psychological, or when we're talking about things that has to ease up a bit and loosen the vaginal muscles a bit, very rarely it could happen. But a lot of the times it needs an insight. So insight is something where you realize and recognize that you have a problem. And if you recognize you have a problem, then you go and reach out for help, which is very, very important. So I think insight is very important. So when you recognize, please go and reach out for help, because vaginismus has so many options. It's definitely treatable. And, like I said, just reach out and you'll see how we can actually help you, get rid of it or work on it. I don't recommend people to do things on their own. And like I said, vaginismus, there could be a few aspects you want to rule out whether anything is actually wrong or, is there. And so you definitely want to go and see a clinician. So doing things on your own is probably difficult. You don't want to do things on your own when it's confusing. It's nice to vent out. It's nice to have a support group. It's nice to talk to other people who are going through the same problem. I know sometimes people like to, keep it in a secretive way, but to be honest, what is really going to help you is probably not that. What is really going to help you is probably reaching out and getting that help, whether it's clinician or a group of women who are going through the same thing, or a psychologist, or any of that. So I personally don't think women should sit on it at home and try to fix it themselves. Vaginismus doesn't make you infertile. Vaginismus is just tightening of your vaginal muscles. So all your vaginal muscles are just holding up tight, saying, I won't let it in. And what we have to do is just loosen it up and see how that works. Your internal organs, or your uterus, your fallopian tubes, your ovaries are the one that is actually connected to your reproductive system. It depends, right? So let's say somebody's got vaginismus and then we're working on it and then it goes away and then things get better. And then again, something traumatic happens. And I think that again causes vaginismus, and that is a possibility. So it's like, I have fever once in my life. Will I get fever sometimes again? Possibly. So it's like that. So if there's anything traumatic or anything that happens that's painful, let's say after everything, they have good sex, they fall pregnant, and then her labor was hideous and her delivery was terrible. So yes, she could probably have vaginismus secondary to having a baby and freak out again, and we might have to work on it again, and that's okay, and that's common because it's painful. It is hard and it's traumatic, and I think rather than feeling ashamed, you should just feel proud of yourself as to how you've gone through these things, and I think we are here to help it out. It's hard and painful. Penetration can be hard after a traumatic event, and just come and talk to people and we can work on it. I think partners play a very, very important role in a woman's vaginismus, especially because they are the ones who are going to be sexually involved with them. And I think as much as we want to educate women about vaginismus, it's very important that men know about it as well. It's like menstruation, it's like period products, it's like PMS. So a lot of things that women go through, it's better if men know, because they seem to play a very important role in women's lives. And it'll be really nice, even for them, to actually get a hang about what's going on, rather than, just being thrown in deep sea and they're thinking, oh my God, I have no idea what's going on. So instead of like that, I feel like we should be very supportive to them as well, in order to, educate them and teach them what's going on and tell them that this is what could be happening. And I always encourage people to bring the spouse as well for counseling and for sessions, that, women come, because there's no point in women coming all on her own and trying to somehow fix this. And, people pointing fingers and saying that was your problem. And I don't think it works like that. It's not good for the relationship. And, and it'll, in fact, if it is a psychological thing that works, I think it's better if both come and actually talk about it. There are some times that there are some, past traumatic events that some partners may not feel comfortable discussing with their current partner, and that's fine. We always check with people's, comfortable, because when it comes to sexual health, I think how much ever we have a couple, or how much ever people are comfortable and they may say, I love this person the most in the planet at the moment, I am very particular about people's privacy and things, because I think sex is a very complicated topic, especially when we're going to dig the past of, people, especially when we're going to talk about sexual encounters in the past or relationships in the past, even the best of relationships. When you're going out of the room, there is a bit of attention. Do you know what I mean? So I am very careful. And I think in our practice, we're very careful. Even if they're husband and wife for a very, very long time, I always consult the patient on their own in the beginning, just to say or check if they are comfortable or if everything is okay. Because then also I'll be telling her that, I'm going to ask these questions. So if it's really okay, that's fine. Sometimes people say, oh, no, I don't want to talk about these things in front of them. And if that's the case, there's no point having both of them, because we're trying to help her come out of her trauma, that like that. So that's that kind of privacy and thing given to the woman, and, consulting her, first just to have a chat, and then involving them both and seeing how it's going to work as a partner is very important. So partner involvement, yes, is very, very important. But I think patient's privacy is also important, independent of whether it's a boyfriend or a husband, it doesn't matter.